Hello guys! Welcome back again to my channel. Today I would like to share with you my personal experience when I did my US medical screening for US Embassy interview here in Abu Dhabi. We will be talking about how to get an appointment, what are the requirements, the medical screening costs, and of course, what to expect during the medical screening. Once you have your appointment letter from the US Embassy, you may now call to secure an appointment for your medical screening. Here are some tips in securing an appointment and what you need to prepare for your appointment. The only medical facility here in Abu Dhabi that is authorized to do the medical screening for the US Embassy interview is the NMC Specialty Hospital, located at Zayed First Street. For the consultation and immunizations, you must go to this building as shown. You may call this number to get an appointment, and you can only call them 7 to 10 days before your desired medical examination date. I actually tried calling them 2 to 3 weeks prior to my desired medical exam date, but I was informed that the doctor's schedule is not yet open. For the x-ray and getting your labs done, please go to the main building as shown. Your medical screening must be at least 1 week prior to your US Embassy interview, and be sure to bring the following requirements. Five pieces passport-size photos, original passport and photocopy of the biographic page, your immunization record, US Embassy interview appointment letter, and this should have your immigrant visa case number, your UAE address, and of course, your USA address. You should also wear comfortable clothing on the day of your medical screening. And make sure to bring hair ties, especially for the girls, for the x-ray. Prepare yourself to also give urine and blood samples as well. Just so you know, US medical screening is not covered by our insurance here. Hence, you can bring cash or pay by credit card. I paid by using Apple Pay. Also, allot at least 3 to 4 hours of your day for the appointment, as there are lots of things for you to do. Plus, there could be other patients in the hospital. In my experience, I had an hour wait for my blood works. My appointment was scheduled at 11 on a Saturday morning last June 26. The provider's clinic is located beside the main building on the second floor. After filling out some forms, I was asked to take a seat. At around 11:30, a nurse came to me to check my vitals and to get my height and weight for the BMI calculation. At noon, I was brought in to see the doctor who did the physical exam, using the head-to-toe assessment, mouth and teeth check, and lymph node palpation check. She also then asked me to take a seat as she did chest auscultation for the heart and lungs. She then asked me to lie down in bed for her to be able to do the abdomen palpation and percussion. She also noted any tattoos. After that, she did a quick history taking of my immunization, medications, allergies, and medical history. Provider then asked me to do a chest x-ray, submit a urine sample, and do the blood works. Eye check was conducted by the nurse using Snellen chart. The nurse then assisted me to the reception where I was asked to pay 350 dirhams for the consultation. Paperwork was also given to me and a follow-up appointment was also scheduled for me. I then went to do the chest x-ray in the main building on the 3rd floor. I paid 120 dirhams and I made sure I brought in hair ties to tie up my long hair. There were no patient gowns to wear, so I was asked to wear my regular t-shirt without the bra. I was the only patient at that time, so there was not much of a wait. After the x-ray, I went down to my last stop for the day on the 1st floor of the NMC main building. I registered in the lab reception and I was asked to pay a total of 660 dirhams. This includes the beta HCG test, which costs me 150 AED. This was added to make sure that I'm not pregnant to receive immunizations on the next visit. In the lab, I waited for more than an hour as there were a lot of patients during that time. I even have to follow up on the reception for 3 times. While waiting, when I felt the urge, I also went to collect urine sample just to save time. I think I finished at 2:30 on the first day of my medical screening. After 2 days, I went back to NMC after my shift. Again, I did register myself at the reception and was asked to sit down to wait for the nurse. Finally met with the doctor and she told me that I will be receiving 3 vaccines for that night. It costs me 470 AED for the first 3 vaccines and another 360 for the second doses of MMR and varicella after a month. After receiving the immunizations, I was told that they will call me if when I can come back for my medical report. Apparently, I have to return to pick up the medical report folders. I was kinda hoping it will be transferred to the US Embassy electronically, but I guess this was still not the case here in Abu Dhabi. After a few days, I received a phone call from the nurse asking me to provide the complete USA address and also to come and pick up my medical reports that night. I was given 2 sealed envelopes. One folder contains the x-ray and the other one contains a medical report. I was also given my own copy of my vaccination record and was asked to return to receive the next doses of my vaccines. There you go! Hope this video can help you out, especially those who will be undergoing their US medical screening soon here in Abu Dhabi. If you have any questions, please feel free to comment down below and I can answer them for you. I will be sharing my US Embassy interview in my next video, so if you haven't subscribed yet, please feel free to like, share, and subscribe. Keep safe and be carefree.